Hi, I'm Tom Burke, the Associate Dean for Public Health Practice here at the Johns Hopkins Bloomberg School of Public Health. Welcome to Public Health on the Inside, your inside look into the world of public health. Today, it's my pleasure to introduce a friend and actually a legend in the field of public health here in Maryland. Dr. David Rogers is the health officer for Calvert County, and his career and commitment to service has spanned more than a half-century. Dr. Rogers began his career in the Epidemic Intelligence Service in 1957, and since then has had many prominent positions across the state of Maryland in public health. He was the Director of Tuberculosis Control at the Prince George's County Health Department, as well as their Deputy Health Officer, and then, 39 years ago, he found his dream job. He became the Health Officer for Calvert County, Maryland, and he is truly the Dean of Public Health here in our state of Maryland. David, welcome to Public Health on the Inside.
Thank you. It's a pleasure to be here.
So it's been an amazing career that you've had, and you are an inspiration and mentor to many here in Maryland. I'd like you to start by giving us a little background on how you got into this field and the things about public health that made it for you.
Well, I had from an early age decided to become a physician, and I always had the idea that rather than being a cutting type doctor, I was going to be a thinking doctor, which meant that I would be going to internal medicine. And it was my desire and dream then to be, I guess, sort of like a Dr. Welby and take good care of my special patients. And what I discovered was, after a few years of practicing medicine, I was really somewhat getting bored with it, particularly the science of medicine. I had subscribed to the Green Journal, the Brown Journal, the New England Journal, and what I discovered was these journals were stacking up on my desk unread. Then I discovered that when dealing with patients, I really didn't want to talk about their illnesses. I wanted to talk about what their lives were about and not have to deal with the illness, although we would eventually get around to that. So it dawned on me after about 5 or 6 years of that, I really needed to be somewhere other than in private practice.
So you were in the EIS, or the Epidemic Intelligence Service, at actually a very historical time in the 50s, including the great Hong Kong flu pandemic. Tell us about EIS and your roots in the U.S. Public Health Service.
Well, I went into EIS at the beckoning of my former medical school classmate, D.A. Henderson, which is a name that is easily recognized, I think, around the world because of what he did in eradicating smallpox. In order to fulfill my draft requirement, he suggested I could do that in a very happy way, coming to the Community Disease Center and become an EIS officer. So I became a U.S. Public Health Service officer for 2 years to fulfill my military draft requirement. And I was happily assigned to the School of Public Health at the University of Minnesota, where I really got involved sort of in the academic part of public health. And I guess something stuck with me there because when I decided to get out of the private practice of medicine, it seemed very natural to go into public health. So I was quite comfortable in doing that. And I had made the decision back then I was going to be a health officer in a small Tidewater, Maryland county. And that's eventually what I did, but it took a while to get there.
So we've talked a lot on our podcast about the dream jobs in public health, and you seem to have reached your dream and stayed at it for a long time.
Well, being a health officer in a Maryland local health department is, I think, in many ways a very desirable position. You are, of course, responsible to the state on the one hand and to the county on the other hand, which, if you play the game correctly, means you're really your own boss.
That's always a plus.
Which is one reason, I believe, that local health departments enjoy a great deal of autonomy, which I think is good because I think it means that local health officers and their staff, if they're managed correctly, are really invested in their jobs because they feel like they're making the decisions on what to do, and it's not being directed from some high-level governmental official. So that's, I think, a real plus for the public health system in Maryland.
Now, Calvert County is not without its public health challenges, and recently the county and you made national, probably international news because of influenza. Can you tell us a little bit about that?
Well, we did have a situation where late on a Monday afternoon we got a call from the hospital that they had a patient who was very, very sick with pneumonia, and that patient's older brother, and these were people in their mid 50s, had just been sent to the big city hospital in Washington with similar, very severe pneumonia. Maybe it was a novel viral infection. Their mother had died of apparently a respiratory infection just a few days previous to that. So you had these two children died on that Monday of a Staphylococcus aureus, so-called MRSA pneumonia. And that got everybody very upset. We had previously, a couple of weeks earlier, had another middle-aged woman die of MRSA pneumonia, probably as a complication of flu. So it suddenly looked as though something was going on here that was very alarming. And the big issue we were trying to deal with was whether contacts of these people should get some sort of prophylaxis. Of course, we were trying to do the three essential things all at the same time. Number one was we were trying to establish a diagnosis, which of course is the first thing you have to do. Do these people have the same illness? And what is it? Is it communicable? The second thing we were trying to do was to establish what the epidemiology was. Of course, the basic thing there is you try to get some sense of the so-called epidemic curve, who got sick with what and when did they get sick, who might have given it to somebody else, and so forth. And the third thing that we were obviously needed to do was risk communication to the public. Because as we were engaged in these deliberations, it was brought to my attention that this thing's going viral on Facebook. There's a lot of information out there which is misleading and is unnecessarily alarming.
So, Dr. Rogers, what are the biggest challenges you face running a health department during these difficult times here in Maryland?
Well, we're always being told that this is the worst year for funding ever, but certainly having an understanding of how to prioritize what you do, which means you have to have a philosophy. Public health at the local level is in terms of what are the essential core public health services. And those are the ones that have to be preserved at all costs with adequate funding and high quality. People who provide funding, governmental officials, legislators, county commissioners, they don't always understand that. So a lot of the most challenging thing is probably to get the people to whom you report and who provide you funding to understand what your needs are in terms of the funding to do what your mission is.
I'd like your perspective on what those core services are.
Well, they are certainly communicable disease control, which of course goes back to the very origin of public health hundreds of years ago. The abatement of environmental health hazards. Of course, that includes food safety, the safe and sanitary disposal of sewage, safe water supply, plus a lot of other environmental situations that we deal with, like swimming pools, which have to be licensed, bathing beaches, so forth. And then we get into the health of young children, which I think the state as a political entity has an interest that young children become healthy both physically and mentally. So when they enter school, they are in the best condition they can possibly be to learn. And of course, healthy children is what maternal and child health, which is a traditional public health service, is all about. The other couple of important things I would just throw in is the ability or the credibility to do authoritative risk communication as that impartial governmental authoritative source so people have real good information to make decisions about. The other thing is, in this day of terrorism, we need to have the capability of emergency response. That's something that really has only come upon us since the tragedy of 9/11. But the capability of emergency response just means the ability to marshal your resources 24/7, anytime, day or night, and give an adequate response to a situation.
As folks prepare for their careers, what advice do you have for them on building their toolbox and on the challenges and joys of being a health officer?
Well, what I would say is that The academic year, or the MPH, is extremely important to get that scientific knowledge base. Without that, you will be revealed as a not knowledgeable person. So you have to be knowledgeable, and you need to have some sense of what public health is all about. But being a health officer is a particularly unique part of public health. It's a combination of law enforcement, risk communication, dealing with politicians, dealing with the government bureaucracy, being able to make decisions, being credible, and also because you are the director of a governmental agency, you need to develop a management style which will be successful. I guess that depends on on the personality of the individual, but management style is something that anybody going into public health to be a director of a public health agency really needs to give a lot of serious thought to what management style is. I, of course, in the course of my career, took training courses in management, all that kind of thing. But you really learn by on-the-job experience. But the thing is to manage in such a way that your staff want to come to work. They see the workplace as a friendly place and not as a hostile work environment. So it's really the person at the top, in this case the health officer, sets the tone for the entire organization.
Dr. Rogers, I want to thank you so much for being here today. You have been truly an inspiration. Your colleagues throughout the state of Maryland and the Maryland Association of County Health Officials see you as a leader, an inspiration, and a mentor. I hear a rumor that you're going to retire in July, but I know you will continue through your leadership, through your writings, and through your mentoring to continue to be a leader to us all. And thank you so much for being here today on Public Health on the Inside.
Thank you. It was a pleasure.
And thank you for listening today. I'll see you soon.